We now move on to health and talk about the Lagos State Mental Health Conference, where the state government is seeking more partnership to help improve mental health services to those already affected with such ailment.
The absence of good mental health is often related to depression, anxiety disorders, autism, eating disorders, learning disorders, schizophrenia, amongst other disorders. Data by the World Health Organization shows that 1 in 4 Nigerians, that's an average of 50 million people, suffer from mental illness and related disorders. In Lagos State, latest reports from the Ministry of Health shows that out of all mental health issues, more cases of depression were reported, which stands at 5.5%, with post-COVID disorders at 15.8% in the year 2021.
Members of the State Executive Council are here.
In reducing the growing figure, the state government is holding a mental health conference tagged Responding to the Mental Health Needs of a 21st Century Megacity. The Deputy Governor of Lagos State, Kadri Hamzat, Head of Service, Hakeem Muriokola, the Commissioner for Health, Professor Akian Bayomi, who also doubles as the Deputy Incident Commander of the state, and other practitioners in the health sector, all gathered at the landmark event center to be part of the conference.
So we're very proud of this facility. We hope
Professor Bayomi highlights areas where mental health has increased amongst residents with emphasis on drug abuse.
in 2018, there has been a significant shift in mentally associated aberrations as a result, perhaps directly related to COVID, but there could be multiple explanations for that. But the change in the data and the parameters is worrying. And it shows, for example, that mood disorders have gone up from 3.3% to almost 10%. Anxiety has trebled. And substance abuse has gone up from about 4% to about 14%. When we look at the summary findings of the collective studies across Africa in 2021, which is just a few months ago, we can see that depression, anxiety, hypochondriac disorders, alcoholic disorders, manifest disability, and psychoactive substance abuse have significantly gone up. In terms of human resources, you can see quite clearly that there is a serious deficit in the amount of human resources that are specialized in the management of mental health. And there you can see we only have about 18 medically qualified psychiatrists in Lagos, and we have just under 200 clinical psychologists, which means that when you put all these parameters together, we have one mental health bed for 1.5 million people. We have one psychiatrist for 6 million, and we have an estimated treatment gap of about 85%. That tells us that we have a lot of work to do in the state. In our general hospitals, we're moving from 5 general hospitals to 10 general hospitals that have the capability to deal with more severe mental health disorders. And we have a 40-bed facility at Lasuth, our tertiary academic facility. And the good news is that this dispensation are building the largest mental health facility in Nigeria, a 500-bed state-of-the-art psychiatric hospital at Ketu Ejiri.
Those in the health sector seek more investment and the establishment of mental health institutions in dealing with such cases.
When we say governance structure for mental health system, we are looking at the mental health policy and mental health legislation. These two are very, very critical to ensure sustainable mental health programs that will address local mental health issues of the community. They are also very important in ensuring sustainable funding and sustainable universal access to effective, affordable, quality, non-stigmatizing or discriminating mental health care for the population. We all know today, modernity has dictated that integration is the best way, is the way forward to ensure that everybody enjoys mental health care service. And Lagos State is doing it, and we are happy with that. However, I have one prayer for Lagos State government. We appreciate the 500-bed quality mental health hospital you want to build. But please, we want you to label it as an institute for mental health. An institute for mental health that will be responsible for research, will be a hub for research in mental health in Nigeria. That will be a hub for training of mental health professionals, not only psychiatrists, across. That will also provide support for all other mental health care delivering institutions.
Mental health is an issue, and we tend to very much underestimate it. And that's why, as a state, based on our culture of continuity of governance, started from BRF time, when we organized the livable city, developed the mental health policy, like the history has been said, the governance structure. And I'm very happy that the current government has taken this matter up as a serious issue. Like the previous speaker said, Lagos State will continue to lead because it's a dynamic process. We think positively, we have the vision, we have the will, we have the people. In this hall, are research people here from the University of Lagos, LASUTH, who actually conducted studies on mental health in this state. We have children's homes, we have remand homes. A lot of them, 70 to 80% of the inmates here have mental health issues, including children. So I think for us as a state, this is the way to go.
And the Deputy Governor, Kadri Hamzat, says the state government is expanding its mode of operation in managing health issues in Lagos.
The General Commissioner for Health has shown us data that shows clearly that a sizable percentage of Lagosians struggle with clinically diagnosable mood disorders like anxiety or depression. The menace of substance abuse is on the rise and will likely become a national epidemic if we fail to address it frontally. Before we get there, I think it's important for us as a society to understand that the biggest challenge is family breakdown. Substance abuse is linked to how we are raising our children these days. The truth is, as parents, as family, we must take care of our kids. We must know what they are doing. We must understand what are the things that they actually focus on in school and so on and so forth. The promotion of mental health and well-being and the reduction of stigma and discrimination of mental health are priorities within the state's development agenda for health, which is to ensure that every citizen has access to effective and sustainable health delivery models. We have set the groundwork for the development of sustainable mental health care program and services that will ensure improved health outcomes in the long term. This will enable the state to become one of the forerunners in the delivery of sustainable, efficient, and effective mental health services to its citizens in Lagos and, of course, in other parts of our country because of the migration input into Lagos. So our goal is to reduce significantly premature deaths through prevention and treatment and promote mental health and well-being in keeping with the Sustainable Development Goal for health.
Mental health stresses can occur at any time, and so the Lagos State Government is asking residents who detect the slightest change in behavior to call the Lagos Lifeline, speak with a therapist, or visit any of the general hospitals and get help as soon as possible.